Hello everyone, welcome to my YouTube channel Pharma Researcher. So this is the video number 14 of Telangana Pharmacist Grade-II exam preparation. The exam is going to be held on the 30th of November 2024 and this is a series on our YouTube channel Pharma Researcher in which we are discussing a total of 10 different units which are mentioned in the syllabus. All 10 units, there are different subtopics mentioned in each unit. So every subtopic related MCQ questions will be covered in this particular series. So in this series, a total of 6 units have already been covered, and the half part of the unit 7 is also covered. So if you haven't watched those videos yet, you can watch those videos on our YouTube channel Pharma Researcher. I have provided the description, the video links in the description as well, so that you can watch the videos from directly access the links. And in today's video, we are going to discuss the remaining parts of unit number 7. So after this video, the unit number 7 will be completed and only 3 units will be left. So that we will be covering before Sunday. So in today's video, we are covering the remaining topics, that is the disease manifestation, pathology of several diseases, adverse drug reactions, poisoning related information, drug dependence. So these different subtopics will be covered in this particular video. If you want the PDF of this particular video, I have provided the 2 links for the PDF. One is with the answer key, one is without answer key, so that you can practice the answers by yourself also. And so let's start with the unit number 7 part 2. So these are the different topics that will be covered in this particular video. So disease manifestation and pathology of tuberculosis, hepatitis, rheumatoid arthritis, cardiovascular diseases, epilepsy, diabetes, peptic ulcer, hypertension, adverse drug reactions, introduction and general treatment of poisoning, systemic antidotes, symptoms and treatments of organophosphorus, heavy metal, opioid, barbiturate, atropine, paracetamol poisoning, and drug dependence, drug abuse, addictive drugs, and their treatment and complication. So these different topics will be covered in this particular video. So let's start with the first topic, that is the disease manifestation and pathology of different drugs and different diseases. So in this particular topic, the first question is, tuberculosis is an ineffective disease which is caused by. So tuberculosis, this particular topic we have also covered in the other social pharmacy, that is a unit number 3. In that topic also, this is the same topic there, like the causative organisms related things. So tuberculosis is an infective disease which is caused by Mycobacterium tuberculosis as well as Mycobacterium bovis. So here option D will be the correct answer, that is both A and B will be the correct answer. If I talk about Helicobacter pylori, so it is the causative organism for peptic ulcer. Then moving to next question. So the question is, through blood, the hepatitis A virus reaches the target. So through blood, the virus, that is hepatitis A virus, it reaches the target like the receptor Kupffer cells. So here option C will be the correct answer. Then next question is, dash influences the functioning of hepatocytes. So hepatocytes are the cells of liver. So hepatitis B virus has that property that it influences the functioning of these hepatocytes. So here option B will be the correct answer. Then next question is, dash occurs after the proliferation of synovial cells in joints. So in this particular condition, pannus formation is basically occurs when the proliferation of synovial cells in joints happens. So basically, what is pannus formation? So it is simply the abnormal growth. It is the abnormal growth of tissues in joints, where in joints there is a abnormal growth of tissues, either in the joints, or it can happen also in the cornea as well, and also in the prosthetic heart valve. So these are the different location. Mainly it was asking regarding the joint, so it is also the pannus formation. So here option B is correct. Next question is, dash is an articular manifestation of rheumatoid arthritis. So articular manifestation of rheumatoid arthritis is simply the inflammation of synovia. So here option A will be the correct answer. Then next question is, dash is characterized by dry mouth and keratoconjunctivitis sicca. So this is the different characteristics of secondary Sjogren's syndrome. So here option C is correct. So here there is a term keratoconjunctivitis sicca. So this term is also known as dry eye syndrome, and it is basically a condition that causes dry and irritated eyes as well. Then if I'll talk about secondary Sjogren syndrome, so it is an autoimmune disease. It is an autoimmune disease which basically uh, occurs when someone with another autoimmune disease develops symptoms of Sjogren syndrome. Like a person is already having some other autoimmune disease, and through that autoimmune disease, he started develop some symptoms of this Sjogren's syndrome, and that's why this term is known as secondary Sjogren's syndrome. Now moving to the next question. The question is, which of the following is not a cardiovascular disease? So among these, angina pectoris, we always studied in cardiovascular diseases. Amyloidosis, it is not an cardiovascular disease. It is a rare disease which occurs when body produces abnormal protein. When body produces abnormal protein, which is called amyloid, which basically builds up in organs and tissues. So this is not a cardiovascular disease. Rest, hypercholesterolemia means the increase in the lipid levels. Then hypertension, increase in the blood pressure. These all are the cardiovascular diseases. Next, moving to the another question. The question is, congestive heart failure is a condition when the, so congestive heart failure, it is a condition related to cardiovascular system, and it occurs when the heart fail to pump blood. So if there is no pumping of blood, there will be no circulation of oxygen throughout the body, and the heart fails. So here option C will be correct. Next question is, dash is a condition characterized by death of cardiac tissues due to disturbed or obstructed blood supply. So a condition in which there is a death of cardiac tissues which is due to disturbed or obstructed blood supply, means our blood supply is disturbed or it is obstructed. In that case, there can be a death of cardiac tissues, and this is a condition which is called as myocardial infarction. So here option A will be the correct answer. It is also cardiovascular disease. Next question is, build-up of dash in arteries and inflammation are the major causes of ischemic heart disease. So ischemic heart disease, in this basically there is a build-up of plaque in arteries and inflammation. So these are the major causes of ischemic heart disease. So basically the buildup of plaque means the buildup of fatty deposit. Buildup of fatty deposits which are generally made up of cholesterol or other fatty substances, or they can be cellular based, there can be calcium, there can be fibrin in the arteries. So these can be if these are built up in the arteries, then they can be this can be a major cause of ischemic heart disease. The next question is, in congestive heart failure of both the ventricles, dash increases. So if congestive heart failure means the blood unable to our heart unable to pump the blood from both the ventricles, then our heart rate will increase. So here option B will be the correct answer. Next question is, dash arises when at the site of plaque breakdown vasospastic mediators are released from the platelet aggregates. So basically this is the coronary artery vasospasm. So this is a condition which arises when there is a breakdown of plaque, and the vasospastic mediators are released from the platelet aggregates. So in this particular condition, the coronary artery vasospasm arises. Then moving to the next question. The question is, the oxygen supply to the heart may reduce due to which factors? So basically the oxygen supply to the heart, it may reduce due to coronary artery spasm. It can be due to arterial thrombosis or inflammation. So these all are the factors due to which the oxygen supply to the heart may reduce. So option D, all of the above will be the correct answer. Next question is, the term angina is used for. So angina term is basically used in case of chest pain, which is a symptom of several cardiovascular diseases. So here option A is correct. Next question is, myocardial infarction can be described as irreversible death of heart cells due to. So myocardial infarction, so it is a irreversible death of heart cells. This term you need to remember. So it is a irreversible death of heart cells which are due to ischemia. So here option C will be the correct answer. The next question is, dash is the cause of most acute type of myocardial infarction. The most acute type of myocardial infarction is endothelial dysfunction. So here option A will be the correct answer. Next question is, dash are involved as the target organs of the hypertensive processes. So basically kidneys are basically involved as a target organ for the hypertensive processes. So it is basically related to urine production, filtration, related things. So here option A is correct. Next question is, which of the following pathophysiological factor do not affect the genesis of essential hypertension? So the factors which are not, which do not affect the genesis means uh, the basically the etiology of hypertension. So it is obesity, intake of sodium, insulin resistance, diabetes mellitus. So it is the intake of sodium. This factor does not affect the genesis of essential hypertension. So here option B is correct. Next question is, epilepsy forms a group of disorders mainly affecting the. So epilepsy basically it forms a group of disorder which mainly affect our nervous system. Okay, so here option B will be the correct answer. Mainly it is due to how abnormal brain activity begins. So it is basically related to brain or nervous system. Then moving to the next question. The question is, which of the following is a non-synaptic mechanism of epilepsy state? So the non-synaptic mechanism of epilepsy state, so this one is the affectic interaction. So here option A is correct. So these affectic interactions, so these are basically a type of communication. It is a type of communication between whom? Between neurons that occurs through electrical conduction in the extracellular space. Where? In the extracellular space. Basically affectic interaction, it is a type of communication between the neurons that occurs through electrical conduction in the extracellular space. So this is the affectic interaction, which is a non-synaptic mechanism of epilepsy state. The next question is, dash type of diabetes occurs due to destruction of beta cells by the autoantibodies produced against them. So basically there are two types of diabetes mellitus. One is type 1 and the other is type 2. So the information for these type 1 and type 2 I have added at the end of these questions. So you can read after these MCQ questions, then you will be having a better clarity. So basically in type 1 diabetes mellitus, it is basically the insulin dependent diabetes mellitus. The other name can be asked. Type 1 is insulin dependent diabetes mellitus and type 2 is non-insulin dependent diabetes mellitus. These names can also be asked. So here the basically the mechanism related thing is asked, like the etiology part. So type of diabetes which occurs due to destruction of beta cells. In this, the beta cells are destructed due to autoantibodies. Okay, so this is a type of type 1A diabetes mellitus. So here option A will be the correct answer. So this is the immune mediated. Okay, and there is type 1B, which is the idiopathic type. So type 1B is idiopathic type, which is characterized by insulin deficiency. It is characterized by insulin deficiency. There is a deficiency of insulin with tendency to develop ketosis. Then moving to the next question. The question is, which of the following mechanisms is responsible for the destruction of islet cells? So the mechanism which is responsible for the destruction of islet cells can be genetic susceptibility, autoimmunity, environmental factor. These all are the factors or mechanism which are responsible for the destruction of islet cells. So here option D, all of the above will be the correct answer. Next question is, DASH is also known as non-insulin dependent diabetes mellitus. So the non-insulin dependent diabetes mellitus is type 2 diabetes mellitus, and the type 1 is insulin dependent diabetes mellitus that I have already discussed. Then moving to the next question. The question is, which type of diabetes mellitus is characterized by either impaired insulin secretion or insulin resistant? So basically the impaired impaired insulin secretion or insulin resistance, it is the non-insulin dependent. So here option D, type 2 diabetes mellitus. So it is the correct answer. Next question is, dash is the main cause of peptic ulcer. The main cause of peptic ulcer is Helicobacter pylori. So here option A will be the correct answer. So I have mentioned you some of the anti-H. pylori drugs, like around 5 drugs I have mentioned you in the classification. I hope you have revised those drugs. So if you remember, don't look back in the notes or in the PDFs. Just try to remember the names and just mention in the comments. And then after mentioning in the comments, you can cross check those 5 drugs, whether you have remembered those or not. Now we can move to the next question. So the question is, dash ulcers result due to destruction of mucosal barrier. So these type of ulcers are gastric ulcers that are due to the destruction of mucosal barrier. So here option C is correct. Next question is, duodenal ulcer results due to. So duodenal ulcers, these are basically due to the excessive acid production. So here option B will be the correct answer. So these two are very important. The gastric ulcers that are due to the destruction of mucosal barriers, these are the gastric ulcers, and the excessive acid production is the reason due to for the duodenal ulcers. Now, with this particular question, we are done with this particular topic. The most important topics has been covered. Now, if we can move to the another segment. So here I have provided you the different classification of epilepsies, which are also known as seizures. So these are the classification or different types of epilepsies. If a question asks from the types, so you can check these different types of epilepsies. Like mostly it can be based on the time period, or it can be based on the another name. Like sometimes the question can be asked like, which type of epilepsy is known as petitional epilepsy? So it is the absence seizures, okay, or absence epilepsy. Or sometimes can be asked like granular epilepsy is also known as, so that is generalized tonic clonic epilepsy. So these different names, you have to remember these names. Also, the other names like atonic seizure is known as akinetic epilepsy. The explanation you can remember, but the other names, these are the most important ones. Like the myoclonic seizures, these are the shock like momentary contraction of muscles of a limb or the whole body. The infantile spasm, that is the hips arrhythmia. Then there are other types of second type, that is the partial seizures. In this also you can simply read the other names like simple partial seizures are also known as cortical focal epilepsy, or complex partial seizures are also known as temporal lobe epilepsy. So these different names you can remember. And the other is the simple partial or complex partial seizure secondary generalized. So these you can, if you can read these one or two times, then you will be able to remember the names itself. Like the petit mal has been asked previously, petit mal seizures, so which are the absent seizures. So these things you can remember. Then also I have added the two types of diabetes mellitus, that is type 1, which is the insulin dependent diabetes mellitus, also known as juvenile onset diabetes mellitus. So these other names you need to remember. Then in type 1A, type 1B, what are the different conditions are in these two types? Few questions we have already discussed, but you can always read the text as well. So basically, I haven't created any notes for this particular series, or I don't have thorough notes. I generally prefer different books for making the MCQs and to collect the information. So those who were asking for the notes, so you have to follow the books only, or whatever questions I am explaining, so you can prefer those. And side by side, whatever the topic is there, so you can simply check those topic in the books itself. Then we can move to the another section of this particular video, that is the adverse drug reactions. So basically few questions are there from adverse drug reaction, and I have added few of the information as well. So first we can start with the first question of this particular topic. So the first question is, any harmful reaction related to the use of a medicinal product which predicts hazards from future administration, warrants prevention or treatments, alteration of the regimen, or withdrawal of the drugs is known as an. So this is the definition of adverse drug reaction. So basically these are the harmful reactions which are related to the use of medicinal products, and what are the different effects that can be related with the use of this medicinal product. So it can predict the hazards from future administration, like there can be a possibility like the patient will become allergic to that particular drug for future use. There can be warrant prevention or treatment. There can be alteration in the regimen, or there can be withdrawal of the drugs. So these are the different conditions which are seen in the adverse drug reaction, and these are the harmful reactions. Now moving to next question. The question is, dash are not associated with dose, may or may not be harmful, and occur via separate mechanism. Okay, so basically these are the effects which are not actually related to the dose, and they may be harmful, they may not be harmful, and they basically occur via different mechanism. So these are the side effects, means when like nausea and vomiting, these are the most common side effects that are associated with most of the drugs. Like if you have seen pharmacology of different drugs, so mostly you will see nausea and vomiting in every other drug as a side effect. The next question is, dash is an adverse outcome that occurs when a patient is receiving a drug, but for which causality has not been determined. So if it is an adverse outcome, like what is the adverse effect? That is the adverse outcome. Like what are the outcomes associated with the adverse drug reactions? And these occurs when a patient is receiving a drug. Okay, when the patient is using a drug, what the main causality means, what is the cause of that outcome is not known. That is the adverse drug event. So here option D will be the correct answer. The next question is, dash is related to the dose and predictable pharmacological action of the drug. This type of ADR can be managed by reducing the dose. So these are basically related to dose, like at a particular dose, these type of adverse drug reactions are occurring. And these are the predictable pharmacological action, like by giving this drug, this can be the possible adverse drug reaction, okay, or adverse drug effect. This can be a possible thing by using this particular drug. So this can be the condition, and by reducing the dose of the drug, these type of adverse drug reaction can be managed. So these are the augmented responses. So here option A will be the correct answer. So simply first here I will discuss with you the different adverse drug reactions. Okay, what are the different types? So adverse drug reactions are basically of 5 types. Okay, 5 types. First one is type 1. Type 1, which is the augmented, and in this augmented type there can be different effects, like the side effect comes under these, the secondary effects, and the toxic effects. So these all types of effects comes under the type A or augmented adverse drug reactions. Then in the adverse drug reaction, the second type is the type B. It is a type B, which is also known as Visare, adverse drug reaction. So the name itself is very important, Visare. Sometimes the question will be asked like, which type of adverse drug reaction is also known as Visare? Okay, and these similar names can be asked. So in Vizare, there can be 2 types. One is allergic reactions. One is allergic reaction. The other one is idiosyncratic reaction. Other one is idiosyncratic reactions. So this table is very important, which I am mentioning you. You can simply draw this table in your copy. Whatever I am explaining, you can create a table so that it will be easy to remember for you. So type B, Bizarre, can be of 2 types. One is allergic, second one is idiosyncratic reactions. So these idiosyncratic reactions are the genetically determined. These are the genetically determined. Okay, so sometimes question will be asked like, which of the reactions are genetically determined adverse drug reactions? So these are the these comes under bizarre, but these are known as idiosyncratic reactions. Okay, now in allergic reactions there are 4 different types of reactions. Okay, in allergic there are 4 different type of reaction. So while making the flow diagram, you can mention 4 different types under the allergic one. One is type 1. One is type 1 allergic reaction, which is known as the anaphylactic reaction. Anaphylactic reaction, this is a very known reaction, like this is the immediate type of allergic reaction. And there can be IgE antibodies are involved. Okay, IgE antibodies are involved in type 1 anaphylactic reactions. Then in allergic reactions only, I am mentioning here, in allergic reactions only, there is type 2 allergic reactions, which are also known as cytotoxic reaction. These are basically due to the antigen antibody complexes. Names are very important. Like for type 1, that is the anaphylactic or immediate type, name is important. And also in type 1, examples can be penicillin, lignocaine, and penicillin will also come under type 4 hypersensitivity reactions or allergic reactions. Then this is a type 2, which is cytotoxic, and in this the example can be the anemia that is due to carbamazepine or phenytoin. Then in the allergic only, the third type is type 3. Type 3 is Arthur's reaction. So Arthur's reaction can be due to the antigen antibody complexes that initiates vasculitis or serum sickness. And here the examples can be sulfonamides. Then in the allergic only, there are the last type of allergic reaction, that are the type 4 allergic reactions or type 4 hypersensitivity reactions. These are also known as delayed hypersensitivity. And in this the example can be T cell mediated T cell mediated contact dermatitis. So this is the example of type 4. Now we have discussed two types, type 1 or type A, that is the augmented allergic reactions, then the type B, that is the bizarre, then there is a type C as well. Type C, total 5 adverse drug reactions are there. Type C is the chronic use. Type C is the chronic use. Then there is type 4, not type 4, type D. So type D is delayed adverse drug reaction. And then there is type E. So type E is the end of use adverse drug reaction. So the names are very, very important. You have to remember all the names, all the subtypes. And names are important. Sometimes the hypersensitivity reaction that I have described you, type 1, type 2, type 3, anaphylaxis or immediate type, cytotoxic reactions, Arthur's reactions, delayed hypersensitivity. So these are very important. Naming part is very important. Now we can move to the next question. The question is, hypersensitivity is a type of dash adverse drug reaction. So hypersensitivity is a type of type B adverse drug reaction. Okay. So hypersensitivity are basically the allergic reactions are only. Allergic reactions only, that are the type of bizarre reactions. The next question is, dash is a type of adverse drug reaction that can be managed by reducing the drug dose or withdrawal of the drug. So it is a type of chronic effect. So these are the type of adverse drug reaction. If we can reduce the dose, reduction in the dose or withdrawal of the drug means no use of the drug. In that case, these effects can be managed. The next question is, local anesthetic creams cause which type of drug allergy? So basically the local anesthetic creams, they cause delayed type of hypersensitivity reactions. So here option D is the correct answer. And these are the hypersensitivity reactions, or we can say the allergic reaction, which these are the type 4 allergic reactions. So these are very important. Next question is, which of these is an example of bizarre effects? So the example of bizarre effect is asking about. So hypoglycemia caused by insulin injection, anaphylaxis caused by penicillin, hemorrhage caused by antioxidant, iatrogenic Cushing syndrome with penicillin. So anaphylaxis, this we have discussed in the bizarre, the allergic reaction type 1. So this comes under the example of bizarre effects. Next question is, dash is a type of adverse drug reaction that can be managed by not using the drug even in the future. So these are basically the bizarre effect only. They can be managed by not using the drug even in the future. Then next question is, dash include idiosyncratic or unpredictable reactions and adverse drug withdrawal events. So these are the adverse drug events type B only. Okay, in type B we have studied the allergic reactions as well as the idiosyncratic reactions. So these comes under type B only. Next question is, dash arises due to sudden withdrawal of many drugs. So sudden withdrawal of many drugs can lead to end of treatment effects. So here option B will be the correct answer. The next question is, dash cause precipitation of severe attacks in congenital porphyria. So basically the congenital porphyria is a rare inherited metabolic disorder. It is a inherited metabolic disorder that basically that simply causes severe photosensitivity. It causes photosensitivity and several other symptoms. So this is the congenital porphyria. So in this, the barbiturates are the drugs that causes precipitation of severe attacks in congenital porphyria. So here option C is correct. Next question is, which was the first drug recognized to cause teratogenicity? So the first drug that caused teratogenicity was thalidomide. So here option D will be the correct answer. And what is teratogenicity? So teratogenicity is basically the ability of a drug. It is basically the ability of a drug, means the ability or capacity of drug to cause fetal abnormalities. Fetal abnormalities means when the child is not having a birth, okay, it is in the uterus of the mother. So at that time, if a mother had some drugs, so these drugs can cause fetal abnormalities, like uh, the basically with the use of thalidomide only, the teratogenic effect is known as phocomelia. Okay, this question is also asked previously, so this is important. So phocomelia is a teratogenic effect or teratogenic abnormalities which is caused with the use of thalidomide, and this drug is the first drug recognized to cause the teratogenicity. Now I'll discuss few other examples with you, like which can cause several other things. So here first I'll discuss the tetracyclines. So these by the use of tetracycline, there can be discolored discolored or deformed teeth. Discolored or deformed teeth can be absorbed in the baby. There can be retarded bone growth with the use of tetracycline. Important one is warfarin as well. Warfarin. So warfarin can also cause teratogenic effect. So this can be depressed nose, eye or hand defects can be seen, or there can be growth retardation can be seen with the use of warfarin during pregnancy. Then there can be several androgens. If several androgens are given, then there can be uh, virilization, limb esophageal and cardiac defects can also be seen. So these type of defects are seen with these kind of drugs. So there can be other drug, that is a still withdrawal. So this drug can cause the vaginal carcinoma in teenage female offsprings. So these are the teratogenic effects that can be caused with different drugs. Most important effect is with the thalidomide because it is the first one and it has been asked multiple times previously. So this is very important, that is a phocomelia. It is a abnormalities caused when thalidomide is administered to a pregnant woman. Now we can move to the another question, that is which of these diseases is induced by salicylates. So the diseases which are induced by salicylates can be gastrointestinal irritation or bleeding. So here option A will be the correct answer. Then moving to the next question. Next question is Cushing syndrome may be caused by. So Cushing syndrome, it is mainly caused by the use of corticosteroids. So here option B will be the correct answer. Next question is skeletal and CNS abnormalities in a fetus are caused by which teratogenic drug? So basically skeletal and CNS abnormalities in fetus, these are caused by the warfarin drug. Okay, so warfarin is a teratogenic effect. This I have already explained you, like skeletal and CNS. These condition can be seen. Also the depressed nose, I have explained you, like depressed nose, eye, hand defects, growth retardation. These different conditions can be seen with the use of warfarin, that is a teratogenic drug. Then moving to the another question, another next question is drug-induced diseases are also known as. So basically, the drug-induced diseases are basically those like if I'm having a disease A and I am taking a drug D to treat this particular condition. But by using this particular drug D, I am developing another disease which is B. So this B disease is known as the drug-induced diseases, and the term used for this disease is iatrogenic diseases, or we can say another name is physician-induced diseases. Physician-induced diseases. So, for example, if I'll give you examples, so isoniazid, by using isoniazid, there can be a condition known as hepatitis. By using the isoniazid, hepatitis condition can be induced. So, these are the drug-induced diseases. Idiosyncrasy is important. Idiosyncrasy is the genetically determined adverse reaction that I have already discussed with you. Genetically determined adverse drug reaction. Basically, in this, the example is uh, if a patient, like in previous videos in pharmacology section also, I have given you few questions regarding the G6PD deficiency. G6PD deficiency. Like in G6PD deficiency, if several drugs are given in patients which are having G6PD deficiency, then there can be hemolysis caused. Okay, hemolytic anemia can be caused. For example, if primaquine is given, or dapsone is given, or sulfonamide is given, methylene blue dye is given. So these drugs, if given in patients with G6PD deficiency, so they can cause hemolytic anemia or hemolysis. So these are the idiosyncrasy, which are the genetically determined adverse drug reaction, or genetically determined abnormal reaction to a drug. And teratogenicity we have already discussed, like these are the ability of a drug to cause fatal abnormalities. So yeah, so these are the few important questions from this adverse drug reaction section. So now we can move to our next part. So here the different things is, so here I have combined these two things, like introduction, general treatment of poisoning, and systemic antidotes, symptoms and treatment of organophosphorus, heavy metal, opioid, barbiturate, atropine, and paracetamol poisoning, because these comes under these common things. Okay, these both the topics are similar, almost similar. Like if we are talking about poisoning, then we are talking about organophosphorus poisoning and these kind of things. So these both the topics are common only. So I have included few questions, and I have added all the antidotes and other things related table to you. You can read that table, you can understand the concept, and most important things I will be marking you by explaining this, so that you can check those. So let's start with the first question. The question is, dash poisoning is self or accidental, and the symptoms appear immediately after the poison is consumed. So this type of poisoning is basically the acute poisoning, which is like self or accidental type, and the symptoms are appear immediately. If the symptoms are delayed, then it will be the chronic one. Next question is, dash method removes unabsorbed poison from the stomach. So the method which is used to remove the unabsorbed poison from the stomach is gastric lavage. So here option C will be the correct answer. Next question is, sodium thiosulfate and dicamerol. So these drugs, these are the antidotes, or these are the solutions in toxic dash poisoning. So these are used in metallic poisoning. So here option D will be the correct answer. Dimercaprol and sodium thiosulfate. Then next question is, dash is used in morphine poisoning. So in morphine poisoning, nalorphine, naloxone, these type of drugs are used. Then next question is, dash is used in heavy metal poisoning, that is in case of arsenic and mercury poisoning. So here the dimercaprol is used, which is also known as British anti-leucide, BAL. So these two names you can remember. So here option C is correct. Next question is, dash is used for the treatment of iron poisoning. So in case of iron poisoning, desferoxamine can be used. So here option D is correct. Next question is, what is the antidote for caffeine poisoning? So the antidote for caffeine poisoning is esmolol. So here option C is correct. Next question is antidote used for organophosphorus poisoning is. So for organophosphorus poisoning, atropine can be used, pralidoxim can be used. So here option C, both A and B is correct. Mostly for organophosphorus poisoning, the question has been asked for with respect to pralidoxim itself. But along with pralidoxim, atropine is also used if pralidoxim is not in the option. If both are in the option, then both are correct. Then also if cholinesterase reactivators are given, then these can also be used as an antidote for organophosphorus poisoning. The next question is antidote used for morphine poisoning is. So for morphine poisoning, the antidote is naloxone, Nalorphine can be used, which we have discussed in previous question. So these are the few antidotes for morphine poisoning. So here option A is correct. Now I have added a few of the classification like for the poisoning itself. So I have added these. You can learn these classification basically, and you can have a basic look. Like the question can be asked like which of the following is corrosive type of poisoning, which can be irritant type of poisoning. So these type of things can be asked. So in corrosive there can be poisons can be strong acid or strong bases. In strong acids, HCl, nitric acid, acetic acid, hydrocyanic acid. In strong bases, sodium hydroxide, sodium carbonate. These are the poisons. So this is not the antidotes. These are the classification of poisons which can cause the poisoning in a person. Then there can be irritant ones which can be inorganic, organic or mechanical. So these you can check, you can read these things, and there can be systemic, which can be basically due to some other diseases as well. For example, there can be several neuroleptic conditions. So these kind of things can be there, which are acting on different systemic effects like the cerebral one, the spinal, acting on spinal cord or cardiac system. So these comes under systemic or neurotics. Then this diagram you can remember, and also there is one of the classification according to the mechanism of action. This is given in one of the book. So based on according to the mechanism of action, antidotes are classified. These are the classification of antidotes. Simply in this particular classification you need to remember the types, like what different types of antidotes are there, because sometimes the question based on this classification will be asked, like simply the definition one. So for physiological antidotes, the question can be like which of the following antidotes can produce effect opposite to that of poison. So these are the physiological antidotes. Sometimes the example can be asked like sodium nitrite is which is used in cyanide poisoning. These both points are important. So in this theoretical thing, I will be providing you the important points which are important and what are the additional that you can remember. Sodium nitrite used in cyanide poisoning, most important question has been asked. And also in cyanide poisoning, sodium thiosulfate is also used, this one, which is a chemical antidote. So sodium nitrite, it is a physiological antidote. Then atropine and physiostigmine, which are the antidote of each other. If we have seen the atropine poisoning, then we can give physiostigmine as an antidote. If in the body physiostigmine poisoning is there, then we can atropine as an antidote. So definition you need to remember, like the antidotes which produce effect opposite to that of poison, that are the physiological antidotes, also known as antagonists. In chemical antidotes, what happens in chemical antidotes? So these basically combine with the poison and change its chemical nature by converting the poison into inactive or harmful compounds. So these similar terms like in chemical antagonism that I have explained in pharmacology section as well. So there I have also explained you, like we will discuss these things later as well. So this is the thing, like chemical antidote which will basically combine with the poison, changing its nature, making it inactive, and producing the antidote type effect. Here the example is sodium thiosulfate, which convert the systemic toxic cyanide into non-toxic thiocyanate. EDTA is one of the example of chemical antidote, which is a chemical agent for heavy metal poisoning. So from here only you will be able to find out the different antidotes. Then there are mechanical antidotes. So they basically act by preventing the absorption of poison into the body or expel out the poison by emesis or elimination through urine. So basically what happens, like if the poison goes in the body, so it will require some surface or some receptors where it will uh, be making some poisonous effect. So what happens with mechanical antidotes, they will not give enough space or enough absorption space for poison to produce specific poisonous effect. They simply, by emesis means through vomiting, the poison can be expelled out, or through urine, we can increase the urine flow so that the poison will uh, immediately leave the body through urine. So in this, the examples can be activated charcoal. It basically absorbs the poison prior to absorption into intestinal wall. The example can be copper sulfate, magnesium sulfate, sodium monohydrogen, phosphate, inactive poison prior to absorption. Also, there is one universal antidote. If we are not able to know uh, which poisoning is there in the body, then we will give the universal antidote, which is a combination of different things, in which the activated charcoal is there and several other agents are there, so that you can check. So these are the three main types of antidotes based on the mechanism of action. Now I have provided you this table. In this table, you will be, most importantly, you have to learn the antidotes for specific condition. For example, for paracetamol poisoning, acetylcysteine, or sometimes the question can be asked like N-acetylcysteine. So this is the antidote for paracetamol. This is most important. For atropine, organophosphorus poisoning is there, and also for organophosphorus poisoning, the pralidoxim is also used. Pralidoxim, this we have discussed in the question as well. Then benzotropine, drug-induced movement disorders. For these conditions, benzotropine is used. Not that important. Atropine and acetylcholine are most important. Mechanism of action you can read on your own. Then this desferoxamine is important. It is in case of iron. Dicobalt acetate, it is for cyanide and derivatives like acrylonitrile. Then for digoxin specific antibody fragments, it is used the antidote in case of digitalis glycoside poisoning. Then dicaprol, which is the British anti-leucide. BEL is British anti-leucide. It is used for the poisoning of arsenic, copper, gold, lead in inorganic mercury. Then phentolamine is not that important. Vitamin K1 is important, like in case of warfarin. Then pralidoxim is for organophosphorus poisoning, very very important. Propranolol is for against beta adrenoreceptor agonist. Ephedrine, not that important. Protamine, it can be important but not as much. For heparin, then this I'm skipping. Then sodium calcium acetate, this is for lead poisoning, this is important. Unithiol, this is for lead, elemental and organic mercury. Then for ethanol is antidote for ethylene glycol methanol. Then flumazenil is there, that is for benzodiazepines. It is very important. Folic acid is used for methotrexate or trimethoprim. Glucagon beta adeno receptor antagonism. Isoprenaline is basically for beta adeno antagonism. Then the next one is the methionine. Methionine is for paracetamol poisoning. This can be used. Naloxone for opioids. For opioids, naloxone, for example, in case of morphine, codeine, and several other opioid drugs, naloxone can be used as an antidote. or nalorphine can be used as an antidote. Then for antimuscarinic drugs, neostigmine can be used. So these are the different things. Then now we can move to, you can read these things. If anything is left, that you can simply Google it, or you can mention in the comments. I will cover in the next parts as well. Next topic is drug dependence, drug abuse, additive drugs, and their treatment complication. Basically, in these, only the definition part is very important, because sometimes the definition is asked like these are the different terms, and the definition can be asked. So I have included few of the questions. First question is, dash occurs on repeated consumption of a drug. If a person is repeatedly consuming the drug, so then that person will be dependent on the drug. So that will develop the drug dependence in that patient or person. So basically, dependence is basically a physiological state. It is a physiological state of neuroadaptation. Neuroadaptation, which is resulting from the repeated administration of drug. So it is necessary. It's continued use to prevent the appearance of distressing withdrawal symptoms. Like if drug dependence has developed, and now a person or patient uh, think that he should discontinue this drug, and if he suddenly immediately discontinue that drug, then there can be several withdrawal syndromes can be seen. So different drugs, for example, coffee or tea, or which are having very mild physiological dependence. Then there can be marijuana, or there can be hashish, LSD, amphetamine, cocaine, nicotine. These are having moderate to severe physiological dependence. And also the benzodiazepines and alcohols, these are having a moderate to severe physiological dependence. Then moving to next question. Question is, dash indicates consuming a drug apart from medical need or in excessive quantities. So basically, apart from medical need means a patient is not requiring that particular drug for treating any particular disease condition, and he is using that drug in excessive quantities, and this particular condition is known as drug abuse. Means when there is no necessary need, even then the person is taking the drugs, or in excessive quantities the drug is taken. So that is the condition known as drug abuse. Next question is, dash is a state when periodic or chronic intoxication develops on repeated consumption of a drug. So basically, this particular condition is the drug addiction. It is a state in which there is a chronic or periodic means at a specific time interval. It develops on a repeated consumption of drug. So if you will see the term periodic or chronic intoxication development on repeated consumption of drug, that is the drug addiction. So there is basically an intense craving to procure the drug by any means. There is a development of tolerance as well, and hence there is a need to increase the dose. If a patient is tolerated to that, then there will be a need to increase the dose to get the same experience as we are getting with the lesser dose. So there are several life-threatening and alarming withdrawal effects also, if we suddenly drops the this usage of the drug. So then next we can move to another question, that is, dash is a state when an individual shows reduced responsiveness to the pharmacological responses of a drug due to prior exposure of a drug. Like a patient A is taking a drug X, is repeatedly he is using that drug. Now after some time, after 1 or 2 months, he will develop tolerance to that particular drug. Okay, he will develop tolerance, means now he is taking a drug X in 100 mg dose. Now by continuously using this 100 mg dose, after 1 or 2 months, this A person develops some tolerance to this particular drug at this particular dose. No, he is not getting the similar effects that he was getting earlier. Now, due to this tolerance, if he needs to increase the dose, then he will get the same amount of experience or same amount of response with for this particular drug. So after using repeatedly the drug, if the person is showing reduced responsiveness, means the effect will be reduced, that condition is known as drug tolerance. So here option C will be correct. Here the higher dose, increased dose will be needed to obtain the same effect with previous dose. And also there is another term, that is the cross tolerance. So cross tolerance, it is another term. So it happens when tolerance to primary drug, when this tolerance to primary drug develops, when a person is developing a tolerance and the individual, for example, I'll give you the example. So with cross tolerance, a person is A having using a drug X. Now he develops tolerance. Okay, for this particular drug. This person develops a tolerance for this particular drug X. Now this drug is of, for example, the mild analgesic, or I'll say simply analgesic drug. So there are several other different examples like related classes of drugs. For example, if I'm using uh, this X drug, which is a analgesic, then there are other drugs, for example Y and Z. These are also the drugs under this particular classification, analgesic. Now this person A develops tolerance for this particular drug X. Now if a person is developing simultaneously the tolerance for the other drugs in the same classification or the related drugs, then that tolerance will be termed as the cross tolerance. So this is the basic difference. So cross tolerance is basically due to the it is related to the related classes of drugs which are already having a tolerance to a patient. Now we can move to the next question. The question is, dash is used for treating the withdrawal symptoms of opioids. So in order to treat the withdrawal symptoms of opioid, methadone is given. So here option A is correct. Next question is phenobarbital, pentobarbital, phenobarbital, benzodiazepines, carbamazepines, and valproic acid. These are given for controlling or suppressing the withdrawal symptoms of. So these are the different drugs which are given to suppress the withdrawal symptoms of alcohols. So here option D will be the correct answer. Next question is withdrawal symptoms of cocaine treated with. So for cocaine withdrawal symptoms, these can be treated with the tricyclic antidepressants. So here option A will be the correct answer. So that's all for this particular video. And also someone has commented regarding the surgical dressings study material. So after completing the all the 10 units, then I will be having sufficient time to provide some additional information. Right now I am not having the exact notes or exact material for these surgical dressings. So I will collect this material through internet or different sources, different books. I will collect this information after completion of the total 10 units. Then I will be conducting another video and I will be providing you the material. So that's all for this video. The video is quite late. I think this video will be uploaded in the night around 10:30 or 10:40. So that's all for this video, and thank you very much. In the next video we will be starting the next video, that is of pharmacognosy. So till then, thank you very much.